Hey, thanks for making it to Veterans Info Tap. I'm glad you made it. This is a little off course from VA benefits, but it affects veterans as well as spouses just as much. This is about Medicare and the fact that Humana is dropping Medicare Advantage plans to over 500,000 folks. Now, you may be one of them. I did find this information and I wanted to share it with you here today. I'm also going to drop a link for Chapter in the description and in the comments. They provide Medicare assistance and help guide you through the Medicare process for free. It's all free through Chapter. You don't have to be a veteran. You could be a spouse. You could be anybody. Mom, dad, brother, sister, cousins, whatever. The link is there. You can share it with anybody. All right. So with that, let's jump into this here really quick. Is Humana dropping your Medicare Advantage plan? Here's what you need to know. I found this on Market Watch. Just came out February 15th, 2025. Sharing it with you here today. All right. Health insurance giant Humana is dropping a staggering 550,000 of its less profitable Medicare Advantage customers, or about 10% of the total this year, as it tries to restore its stock price and its profits. Of course, right? That's the name of the game. Quotation here: "We now anticipate full year individual MA membership losses of approximately," which would be Medicare Advantage membership losses of approximately 550,000, inclusive of plan and county exits. Chief Executive Jim Retchen, I'm not sure how you say it, told investors in a statement to coincide with the company's quarterly earnings report. Maybe not profits, who knows? Anyway, moving on. "We're shedding unprofitable plans," which really sucks when you think about it from a medical coverage perspective, right? Pretty sad. All right, so we're shedding unprofitable plans. We're resetting expectations and lower margin plans, and we're shifting our membership mix with a focus of sustainable long-term value. He then explained to analysts during the conference call the membership losses that we've experienced have largely been consistent with our strategy. So, in other words, intentional. So, again, if you have any, whether it's Medicare A, B, C, or Medicare Advantage, whatever you're looking for from a Medicare perspective, whether you're getting ready to turn 65, you're already over 65 and you're in the window of Medicare Advantage, or if it's for a loved one, again, the link is in the description and in the comments for Chapter, which can provide you information for free. All right. Humana won't be alone, by the way, in cutting back on its Medicare Advantage offerings. Other insurers, including CVS and others, have also warned that they are cutting back on lower profit or no profit customers in the troubled program. Humana's news comes in the middle of Medicare Advantage's annual open enrollment period, which is from January 1st to March 31st each year. And we're in the middle of that because we're in February. So January 1st through March 31st is the open enrollment for Medicare Advantage. All right. And during which customers are free to switch plans. The cuts will mean turmoil and confusion for many beneficiaries, as well as the risk of higher premiums, fewer benefits, or both. This is we're at the front of it here, and we're going to have to see where the dust settles. But there may be a silver lining. Many of those losing Medicare Advantage plans may also get a rare and valuable chance to do basically a do-over, allowing them to join traditional government-run Medicare instead and get supplemental Medigap coverage at beneficial regulated rates. Quotation here: it really depends on the circumstances," said Meredith Freed, a senior policy manager at the health policy nonprofit KFF and an expert in Medicare. "Broadly speaking," she says, "if your Medicare Advantage insurer, whether it's Humana or any other company, quits your county completely or drops your plan and stops offering any other plans, that are similar to yours, then you may be eligible for what is known as a guaranteed issue right. That effectively means that you could join traditional government-run Medicare under pretty much the same terms that were available when you turned 65. So that is a silver lining, and you need to be aware of it instead of just kind of fumbling through. On the other hand, if your Medicare Advantage insurer stays in your county and automatically transfers you to a similar plan from one health management organization plan to another HMO plan, for example, you may not have that option, Freed said. Keep in mind, Medigap plans are regulated by states, not the federal government. So that's important to understand. Keep in mind, Medigap plans are regulated by the states, not the federal government, meaning that you may get extra eligibility options depending on where you live. Moving on, another quotation. The people affected by this move should be getting a letter from their insurer saying whether they're being assigned to another plan or not, she says. This option may matter to people, traditional or original Medicare, under which you are insured by the federal government, typically pays for 80% of your medical costs. Most people on the program pay for a private insurance plan known variously as a supplemental or Medigap plan to cover the other 20%. When you first qualify for Medicare at age 65, you have that 6-month window during which you can buy Medigap plans under favorable conditions. Insurers who offer such plans have to offer them to everyone who is eligible under strict regulations. But it's a one-time deal. If you don't take up the offer and instead opt to go with the fully privatized Medicare Advantage plan, the window closes. Generally speaking, if in the years ahead you want to switch from Medicare Advantage to the government plan, you won't have any guarantees when it comes to finding a Medigap plan. If you have to pay through the nose, you may have to pay through the nose. That is, if you can get a plan at all. It's a confusing world, right? I am 50, so I mean I got 15 years. I am 100% with the VA, and I get all my stuff from VA. But ironically, the VA says it's probably a good idea to also have Medicare and basically be dual covered. This would allow you to be able to seek care really anywhere, and depending on your healthcare situation, it might make sense. But Chapter, again, link in the description and in the comments, is really an expert in this field for those questions that you may have. Moving on, it goes on to say plan closures like those being announced now offer a rare chance. In many cases, says Freed. The Medigap window may reopen if you want to move to traditional Medicare. Huge. The Centers for Medicare and Medicaid Services, the government department that runs Medicare, did not respond to a request for the comment from the Market Watch publication. The latest turmoil, again, raises the question of whether most of us are better off simply sticking with the traditional government-run Medicare instead of putting ourselves at the mercy of a private company whose executives and stockholders have interests that are different from our own. For years, the insurers have argued that Medicare Advantage was a win-win-win for customers, stockholders, and taxpayers. But the Medicare Payment Advisory Commission, the panel of medical experts that advises the government on the program, pointed out last year that there was a simple reason Medicare Advantage programs could apparently offer customers a better deal. It was billing taxpayers an extra $83 billion a year. Quotation here, Medicare Advantage plans are facing an extended period of reckoning, says Philip Mueller, the author of the book titled Get What's Yours for Medicare, Maximizing Your Coverage and Minimizing Your Costs. The insurers have said, have been on a gravy train for years. So, there's a lot going on. Again, you have to speak with an expert. chapter is an expert in this. Their links and stuff are in the description and the comments. All right. As customers have just been reminded, a private insurance company with stockholders has to keep them happy. Meanwhile, it says something that when the nonprofit Commonwealth Fund spoke to Medicare Advantage brokers themselves, many said that they personally intended to stick with the government plan. And with that concludes it. Again, I found that on Market Watch, came out February 15th. Sharing it with you here today. Please, if you haven't hit the thumbs up, please do so. If you hung on till the end, subscribe, share with a friend, all that good stuff. I truly appreciate it. And remember, if we don't take care of each other, something went wrong.